Hypopituitarism is an endocrine disease condition. Look at this picture shows that pituitary gland and signs and symptoms in children. Look at this. Then MRI, brain imaging, pituitary gland. Look at this. Detail going on. Introduction. Hypopituitarism is a rare but serious disorder in which the pituitary gland fails to produce one or more of its hormones, or not enough of them. Since the pituitary gland regulates several other endocrine glands, this condition can affect multiple organ systems. Prompt diagnosis and lifelong hormone replacement are often essential. Definition. Hypopituitarism is a clinical syndrome characterized by partial or complete deficiency of one or more of the hormones produced by the anterior or posterior pituitary gland. Etymology. The term hypopituitarism comes from the Greek prefix hypo, meaning under or less than normal, and pituitarism referring to the function of pituitary gland. It literally denotes an underactivity of the pituitary gland, reflecting reduced hormone production. Epidemiology. Hypopituitarism is a rare disorder with an estimated prevalence of approximately 45 cases per 100,000 people and an annual incidence of 4 to 5 cases per 100,000. It can occur at any age but is most commonly diagnosed in middle-aged adults with a slightly higher prevalence in males, especially when caused by pituitary tumors. Types. 1. Based on onset, congenital hypopituitarism present at birth. Acquired hypopituitarism develops later in life. 2. Based on extent, partial hypopituitarism, only some pituitary hormones are deficient. Panhypopituitarism, complete deficiency of all anterior pituitary hormones. 3. Based on location, primary pathology within the pituitary gland. Secondary, due to hypothalamic disease affecting pituitary stimulation. Causes: 1. Pituitary tumors, adenomas. 2. Brain surgery or radiation. 3. Traumatic brain injury. 4. Infections. Example: meningitis, tuberculosis. 5. Autoimmune hypophysitis. 6. Sheehan's syndrome, postpartum pituitary necrosis. 7. Genetic mutations, example PROP1, POUAF1. 8. Infiltrative diseases, example sarcoidosis, hemochromatosis. 9. Stroke or aneurysm near the pituitary. Risk factors: 1. Head trauma. 2. Brain tumors or surgery. 3. Radiation therapy to brain. 4. Family history of endocrine or genetic disorders. 5. Postpartum hemorrhage in women. 6. Infections affecting the central nervous system. Complications: 1. Infertility. 2. Growth retardation in children. 3. Adrenal crisis, life threatening. 4. Hypothyroidism. 5. Hypoglycemia. 6. Osteoporosis. 7. Sexual dysfunction. 8. Depression and cognitive impairments. Pathophysiology. Pathophysiology of hypopituitarism, step by step process. 1. Damage to hypothalamus or pituitary gland caused by tumors, trauma, surgery. Infraction, example Seaman's syndrome. Infection or inflammation. 2. Impaired hormone production or release. The anterior pituitary fails to produce adequate amounts of one or more hormones, example ACTH, TSH, LH, FSH, GH. Prolactin. 3. Reduced stimulation of target endocrine glands. Without stimulation from pituitary hormones, the adrenal glands, thyroid gland, and gonads reduce their hormone secretion. Example cortisol, thyroxine, sex hormones. 4. Decline in peripheral hormone levels results in secondary adrenal insufficiency, hypothyroidism, hypogonadism, growth hormone deficiency, and sometimes diabetes insipidus. if posterior pituitary is involved. 5. Physiological dysfunction across systems leads to a range of systemic effects: fatigue, hypotension, infertility, metabolic slowing, growth failure in children, and fluid electrolyte imbalances. 6. Progressive hormonal decline. If untreated, multiple hormone axes can be affected sequentially or simultaneously, worsening the patient's clinical condition. 7. Clinical manifestation. The patient presents with symptoms depending on these specific hormone deficiencies and severity of gland dysfunction. Signs and symptoms depending on the hormone affected: 1. ACTH deficiency, fatigue, hypotension, hypoglycemia, weight loss. 2. TSH deficiency, cold intolerance, weight gain, bradycardia, constipation. 3. LHFH deficiency, infertility, amenorrhea, decreased libido, erectile dysfunction. 4. GH deficiency, decreased muscle mass, increased fat, poor quality of life in adults, growth retardation in children. 5. ADH deficiency, posterior pituitary, polyuria, polydipsia, diabetes insipidus. 6. Prolactin deficiency, inability to lactate postpartum. Diagnosis: 1. History and physical examination. 2. Hormonal testing, baseline and stimulated hormone levels, example insulin tolerance test. 3. Imaging, MRI of the brain and pituitary region. 4. Other test, visual field testing if tumor suspected, genetic testing in congenital cases. Nursing diagnosis: 1. Risk for deficient fluid volume related to decreased ADH secretion. 2. Fatigue related to hormonal imbalances. 3. Disturbed body image related to physical changes. 4. Risk for injury related to hypoglycemia or hypotension. 5. Ineffective coping related to chronic illness. Medical management: A. Hormone replacement therapy. 1. Cortisol, hydrocortisone. 2. Thyroid hormones, levothyroxine. 3. Sex hormones, estrogen, testosterone. 4. GH, somatropin in selected cases. 5. ADH, desmopressin. B. Treatment of underlying causes, example tumor, resistance, antibiotics. C. Emergency care in adrenal crisis. Nursing management. 1. Monitor vital signs, fluid, electrolyte balance. 2. Assess for signs of hormone deficiency. 3. Educate on hormone replacement adherence. 4. Monitor for side effects of hormone therapy. 5. Provide emotional and psychosocial support. 6. Encourage follow up and compliance with therapy. Treatment options. 1. Lifelong hormone replacement therapy. 2. Surgery or radiotherapy for pituitary tumors. 3. Regular monitoring hormone levels. 4. Genetic counseling in congenital cases. 5. Management of complications, example osteoporosis, infertility. Psychosocial medicine. 1. Counseling or psychotherapy in address depression or anxiety. 2. Support groups for patients with chronic endocrine disorders. 3. Patient education about disease, medications and self-care. 4. Family involvement to strengthen support system. 5. Vocational counseling for work related limitations due to fatigue or cognitive changes. Prevention. 1. Early diagnosis and treatment of pituitary tumors. 2. Prompt management of postpartum hemorrhage. 3. Use of protective headgear to prevent TB. 4. Careful monitoring during brain surgery or radiation. 5. Genetic screening in families with known mutations. In conclusion, hypopituitarism is a multi-factor disorder that can be significantly impair quality of life if left untreated. Early recognition, accurate diagnosis, and appropriate hormone replacement therapy can help restore endocrine balance, improve systems, and prevent life-threatening complications. Interdisciplinary care involving endocrinologists and mental health professionals is vital for comprehensive management and support. Thank you. Have a nice day.